Hello everyone, it's Dr. Teba and it is an echocardiography report of dilated cardiomyopathy and systolic heart failure. The patient is a 65 years old male. The identification is evaluation of angina and suspected heart failure. The procedure is explained here. Transthoracic echocardiography was performed using a standard protocol. Images were obtained in the paraaxial long axis and paraaxial short axis, apical 4-chamber, apical 2-chamber, and subcostal views. Doppler studies were conducted to evaluate blood flow across heart failure. These are the findings. Left ventricular systolic function. The left ventricle is dilated with an diastolic dimension of 6.5 centimeters. The left ventricular ejection fraction is estimated to be 35%, indicating reduced systolic function. There is global hypokinesis of the left ventricular wall. Left ventricular diastolic function. Doppler assessment of mitral inflow and tissue Doppler imaging indicates impaired relaxation consistent with grade 1 diastolic dysfunction. Right ventricular function. The right ventricle is normal in size and function. Valvular findings. Mild microregurgitation and tricuspid regurgitation are noted. Diastolic and pulmonary walls appears normal. Atrial dimensions. The left atrium is mildly enlarged. The right atrium is normal in size. Pericardium. No pericardial effusion is present. No intracardiac masses or clots are observed. The aortic root is normal in size. This is the impression. The echocardiographic findings are consistent with dilated cardiomyopathy and systolic heart failure. There is evidence of reduced left ventricular ejection fraction with global hypokinesis and mild diastolic dysfunction. Mild mitral regurgitation is also observed. These findings suggest the need for further clinical correlation and may warrant initiation of adjustment of heart failure guidelines. Recommendations include further advice and referrals, clinical follow-up for heart failure management, including optimization of medical therapy, consideration for cardiac resynchronization therapy if patient meets clinical criteria, repeat echocardiography in 6 to 12 months or sooner if clinical status change.